think what we've got here is not healthcare reform. It's not about making our lives better. What this is about is really about a power grab. It's really the third stage in a 7-month campaign for a power grab by this administration. And it is transformative. You know, elections have consequences. They sure as heck do. Hallelujah. And we got change. Remember that when you go to the ballots.
Hawaii, I'm a citizen of America, but I'm not a citizen of the world. I just want to make everybody understand that. I don't have any questions, but I will say, I'll keep it short. I'm an analyst, I'm an applied mathematician. We do analysis for the Commander of the Pacific Fleet here in Hawaii. And Dr. Rasmussen and Ms. Hahn, I think your analysis is spot on. The gentleman from AARP, not only is your analysis full of massive conjecture, but your facts are unsubstantiated. And one of the things I want to jump on, and many people before me have said this already, I keep hearing this number, 45 million insured. Okay? Our own Congressional Budget Office is showing that out of those 45 million that the government is touting to everybody to think that we have this massive problem, okay, 12 million of those people are already eligible for Medicaid or the state children's health insurance program. Okay? 10 million of those people, as I keep hearing over here, are illegal immigrants. Okay? Djou and O'Neill, who was the former director of the Congressional Budget Office, just released a new study, and it shows that 43% of the people that are uninsured make 250 times above the poverty level, which is about $55,000 a year for a family of 4. So it's not just that poor people are the uninsured. Lastly, Mark Coley from the University of Pennsylvania and Kate Munford of Stanford University published a study to show that out of that 45 million that the government flouts around, nearly 3/4, 75% of those people can afford health insurance, but they just choose not to buy it. Okay? So the numbers that the government is pushing around are completely incorrect. The last thing I want to leave you with is that in my line of business, we do a lot of analysis, and one of the things you have to do is you have to get your assumptions right. Okay? There's a saying in the military analysis community that the amateurs study the plan, the experts study the assumptions. And if you believe the conjecture that the man from the AARP is talking about, then you have to assume that the government is going to go ahead and offset the insane care of this bill by cutting Medicaid and Medicare. Okay? You have to assume that people want to be told what to do, how to do, and when to die. Okay? You also have to assume that people are perfectible and that they're just going to go be willing sheep to conform to whatever government policy you have for the so-called common good. Okay? And lastly, and not least, okay, is that you have to assume that the free market capitalist system in America does not work. And in my opinion, all those assumptions are completely incorrect. My assumptions are that the free market capitalist system in America does work. That's why we've gotten where we are in the last 233 years and no other nation on earth has. The last thing is, I hear a lot of words about competition and choice. Well, ladies and gentlemen, it is competition and choice that allows the people to make the decisions, to ration their own wallets and not have government do it. Because, ladies and gentlemen, another assumption, and finally, that I don't believe in, I definitely don't believe that some far-off, elitist people in the capital, far distant away from Hawaii, can make better decisions for me than I can for my family.
I want to thank all the panelists and volunteers for coming out here. Dr. Rasmussen from the Health Association, Hahn from Grassroot, and a big round of applause for Bruce Workshop.